Welcome back, everyone, to the International Training Institute of Health Masterclass, and we're going to be talking about hip conditions. And you know what? Hip conditions are getting worse and worse, or should I say more prevalent. Mm-hmm. So why are they getting more prevalent? Because we're an inflammation nation. Yep. It's all about inflammation. All right? The more inflammation that we have, the more scar tissue formation, the more calcification, displaced calcium, more crystallization. And what happens when you get calcium and you get crystallization and scar tissue in your joints? Okay, so just try to look at this as a joint. Your joint has to move smooth, right? Synovial fluid, it's got to move properly. But now you start getting this grit, okay, caught in the joint. So what happens is the calcium is almost like sandpaper, wouldn't it be? Mm-hmm. Always wearing away at it, irritating it. But the calcium was pulled there to try to bring down the inflammation in the hip. Yeah. Yeah. But now you get too much calcium, and it's just like having granules of sand. Mm-hmm. You get too much crystallization, and it's like little micro razor blades actually at the tissue. And then we get the medical system, when they do an x-ray, because of the calcification and because of the crystallization, because of the scar tissue formation, what do they say? Tell me what they say.
Bone on bone.
Bone on bone.
And that's really not the case.
Yeah.
The cartilage has become so dehydrated from the improper lifestyle and improper care and the inflammation.
It dries it out.
And then it pulls the displaced calcium from the bones to calcify, and it's almost like it encases it in this little
it's
shell.
Like a calcium cocoon.
Yeah.
And that goes around the joint, and you have the hard surface now, and doctors don't see anything but that hard surface. So it's just bone on bone.
Mm-hmm.
So they're calling it bone on bone, and we can tell you right now, and we're coming from a place of knowing. The reason why we tell people that we give you a money-back guarantee, that the first treatment that you have will show you that you can reverse this condition, and that we're going to reduce the pain and increase the range of motion, the strength and the elasticity in there. And we guarantee that because we've been doing it now. I've been doing it for over a quarter century. So you have to understand something. Surgeons do surgery. Most doctors will prescribe anti-inflammatories for the pain, which I understand. But the reality, what we do is we show you how to get the displaced calcium back in the bones, how to melt the crystallization out of there, how to return the blood flow, the energy flow, the circulation, the lymph flow, so that you restore the tissue that looks like and feels like beef jerky in there back to beautiful connective tissue, whether it's a tendon, ligament, or cartilage.
Yeah.
Definitely.
Yeah.
And we see so many people with hip conditions coming through our clinic all the time, whether they need a hip replacement or they just have arthritis or osteoarthritis or rheumatoid arthritis of the hip. And we see these conditions turn around so quickly. And do you want to talk about a couple?
Yeah, sure. Well, about like 2 years ago, had a family come out, and this gentleman, he got into an accident at work. He was on like one of those like forklifts that like raise you up higher to like work on like power lines or something. And it was on like some kind of like elevated, just say kind of like table or thing. And as he was driving it, it went off of it. And he actually got thrown from the forklift about like 30, 40 feet and landed kind of directly on his neck. And he apparently crushed 3 vertebrae. He like, when he came to us, like needed assistance going up and down the stairs. Walking was like the biggest task. He had like the hand walkers and like constant tippy toes. He could never get his feet flat on the ground.
We have this testimonial, and it's up on YouTube.
Yeah, and so if you guys go to the Detox on YouTube, you can find that there. But he spent a week with us and worked on him and taught his family how to do it. And within the first week, he walked out of there putting his feet for the first time flat on the floor.
Because he was working.
He was still needing the assistance, of course, but we got the elasticity back into the Achilles tendon, got the circulation and the temperature up, melted down those ice blocks, which is that crystallization, calcium displacement, and scar tissue formation. worked on that, got his family to continue working on it, and like now he has like hardly any problem walking.
Okay, so and then just even let's take a case just what
3 weeks ago.
3 weeks ago. So it's not like this doesn't happen for us.
Yeah.
Professional rodeo cowboy, and so
yeah, he's one of the fastest ropers in North America, and he's already had 2 hip surgeries on his right hip, not replacements, just surgeries. So we kind of got lucky there, because when the replacement's in there, you got that foreign object, so you have scar tissue formation wanting to go there immediately, no matter what. Of course, with an incision in hip surgery, you're going to get that as well, just not as extensive. And so he had that done, and then he was booked for actual hip replacement on his left hip, and his rodeoing is coming to an end, so he's been kind of like...
Well, no, they told him that you're going to have a double hip surgery.
A double hip replacement,
and you're going to have
year.
to stop after the surgeries. You're not going to be able to do to be a rodeo cowboy anymore.
Yeah, so he was looking at like different alternatives, like what am I else going to do for work? And then we were like, come out here, because his mom took the course, and his mom was like, you should really check this out. He came up to us for a week. We worked on his hips. We actually went to his rodeo that weekend, and he didn't place the best because he didn't realize how much movement he had in his hips. And so first time he jumped off his horse and went to go tie up the calf, and actually fell onto the calf because he didn't realize he had that much mobility now.
He had all his
weight going
flexion.
forward.
He had all his flexion back in his hips.
He fell on the calf.
Yeah. So, but now he's got his groove. You know.
Yeah.
He had to re-find his center of balance.
Because we really don't even realize though, our bodies are slowly progressing to getting more locked up, and it's like yes, of course I'm 18 and I can do everything, and then think about it slowly over the next 15 years. You're like, wow, if you really think about it, why can't you lift your shoulder over here? Why can't you twist your neck when you're going to shoulder check? All of that is scar tissue formation, crystallization, and calcium displacement. And so we went in there, and then he actually ended up coming back to us for another week, and we worked on his hips, and he's been doing great ever since.
In 3 weeks, he lost over 30 pounds, okay? And he's totally pain-free. And I was just talking to his mother yesterday, and he's down in Texas, and he just bought a new horse.
Yeah.
So, I mean, this cowboy...
The rodeo's just starting.
Yeah.
Giddy up. All right. Yeah. So we have a lot of other cases.
So this stuff happens all the time, though. So, like, don't think you are special, but don't think your condition is special that, like, it can't be fixed. Everything is reversible if you want it to be.
And I know this is really hard to believe, but people come to us with scoliosis, spine problems, ankle problems, knee problems, hip problems, shoulder problems, elbow. It doesn't matter. And honestly, guys, okay, who's the last person that went for surgery that came to us that it didn't work? Can you remember?
No one.
Didn't happen.
Within my 5 years of full-on doing deep tissue for the company, I've never personally had somebody booked for surgery that had to go, and neither has Abby that I know. So it's not needed.
Yeah.
So we're just kind of throwing out the medical, throwing out what we do, and you can pick your choice.
Which option works best for your...
We're just laying it out like a menu, and then you can pick from the buffet.
Yeah.
Right.
So should we get to some hip conditions?
Let's get to it.
Okay, so we're going to start with arthritis. Hip arthritis is a common condition that causes problems with the ball and socket joint at the junction of the pelvis and lower extremity. When arthritis occurs, the normal joint becomes inflamed and painful. There are many different types of arthritis that can cause pain in the hip joint. And we will get into those after we talk about arthritis.
Yeah, and just understand that we basically did. But the reality is arth means joint, itis means inflammation, and that can be in any joint, anywhere within your body. And understand, it's not a disease. Yes, you think it is because you take a medication.
Because they gave you a name for
and
it.
It's not a medication you take a drug, okay? And you're telling your body to shut up and quit causing me pain, but the inflammation is still continuing, which means that your tissue is degenerating, your joint is degenerating as you speak, but we've made you more comfortable in an uncomfortable situation. And that's the deal right there. There's not a lot to say about it. You have a choice. No, I don't care if I get fixed. And also, since I've had this hip problem, you know what? The family's been giving me the love that I feel I've never gotten. And you know what? I'm okay with this new walker. It's great. There's a basket in it. I can put my snacks, you know?
And some people don't even realize that, like, that's the programs they're running. They're like cool with their life, and then all of a sudden one problem starts to happen. They get a condition, and then the family's showing them attention, and they feed into that they start feeding that condition because it's like, I'm finally getting attention that I wanted.
You know what? I'm scared to go walking because I'm going to get run over by a scooter. You know, how many people, do you know how many people are buying scooters that can still walk today? They can still walk.
Yeah.
Okay. All right. But they've opted for a scooter. Now, I'm not downing them. Okay. It's painful. And they say that they don't have a choice. It's drugs and they can't go forward. All right. But the reality is, now they do have a choice. Okay. So there is a choice. There's a choice of learning how to do the perfect day. There's a choice of learning how to do the 12 Braveheart steps.
Okay, it's all about fixing the inflammation, and that comes from your lifestyle. So we need to incorporate the perfect day, drinking lots of structured water. We need to be foam rolling the area, right? Let's get into
what about pelvic expansion? Okay, we have what's called a pelvic expander, and you'll see it in one of our other videos. We're going to be showing it because it's part of our treatment when people come. But we have our patients and our clients will come and they will get a pelvic expander so they can continue these things at home. They'll get a core twister.
Because without the deep tissue, you don't even need the deep tissue, and the pelvic expander slowly, it's not that it's removing the scar tissue completely, but it's pulling it apart to get that actual circulation and blood flow in there itself.
Well, once we've done the deep tissue or the Wolfe Non-Surgical, when we've opened that up and we get that movement in there now, when you go home, it just opens everything else up. And then if we teach you the padding, the clapping, and if you actually want to come and learn the technique yourself,
there's no pelvis you can't unlock.
There's nothing you can't unlock in a pelvis. And remember something, you've got pelvis inflammation before you have hip inflammation. But you know, the standard procedure for the hip is just to work on the hip. You know, most people don't look at the hip as just being the symptom. And the hip is just a symptom. It's not even the true cause. So when we say, oh, you got to work on the scar tissue and the calcification, crystallization in the hip, that's still not the cause. The true cause is coming from the pelvis. And then from there, you got to look at the abdomen, right? And, you know, that's for eliminating the true cause. But then to work on the hip, we know we got to work on the low back. We got to work on the pelvis. If we don't do those two things, then we're not going to unlock the hips, right, guys?
It's a whole. It comes as a whole. We need to work the entire area. And especially with the hip flexors, that's one of the big areas that really gets missed when people are getting hip treatments done. And the work we do with the hip flexor is like nothing I've ever experienced before. And I'm coming from a background of playing soccer my whole life. My hip flexors were a mess. And this was the only thing that completely restored them back to normal. I had the hips of like a 60-year-old before I started getting this work done. And now it's back to like 12 years old again. It's amazing.
Yeah, and you can always get like benefits from just working on the hip, but you can't have inflammation in the front and inflammation in the back on your lower back and sacrum area, and then right on your pelvis. That inflammation here and inflammation here is putting that compression on the hips. So of course you're going to notice, oh, my hips are irritated, but it's in the front and the back. That's where we want to isolate first, and then you go into the hips, and then that's unlocking everything.
Especially with today, like so many people have pelvic tilts, their SI joints are completely frozen. All of this restriction is restricting your hips from properly moving as well. So it really is the whole pelvis that needs attention when addressing any hip conditions, especially when they are chronic.
Most definitely.
And you know, that's the thing about our New World practitioners that we actually train. They look at the cause. They're not distracted by the symptom or the symptoms. And I will tell you something right now. You'll know when you're treating the symptoms because you just don't get better. And surgery is not called getting better. Surgery does not make you better. Okay? So if you believe surgery makes you better, then that's great. And if you believe that drugs make you better, then that's great. But I haven't seen anybody become better, like a better runner, like a better thinker, taking drugs. You know,
or getting surgery.
You think better. Okay. So
there's a lot of thinking there.
Yeah. So you really got to look for where the true cause is. It's the same thing with with breast problems. We don't understand the true causes at the other end. And we call that the whiplash effect. The action is my hand going back with the whip, and the snap is at the other end. Okay? So it's the same thing when we work on people with neck problems. We always want to work on the SI joints because they move everything, and we want to work on the coccyx, which is the bottom part of your spine, and then you work on the occiput and up where the brain stem comes in. Because, one end, you untie this end, you untie that end.
Get the spinal fluid moving.
That's right, because you got to untie things. That movement is what really makes it. And it's the same thing when we say you want to untie the low back and you want to untie the pelvis, and then guess what? You're ready to go in and you're ready to reverse any hip problem that I know of.
Yeah.
Anyways,
Especially,
I'm not saying that someday we're not going to have somebody come in and we're going to have to give them their money back. We will. There's always that person, but the odds are in our favor.
Definitely.
Right?
Yep. And with hip treatments as well, when we're doing the treatments, it's absolutely amazing to see the range of motion that comes back instantaneously.
Immediately. Like somebody will be able to like lift their legs so far.
Yeah.
And then afterwards, it was just right like maybe 3 months ago when I was in Saskatchewan. Yeah. She didn't want work at all, and then I was like, just let me do your hips because you have really like not great movement. And then she's just like, okay, we'll just do one today. That one leg just like came right up to her chest compared to the other. It was just like instant.
Yeah, it's so gratifying. Yeah, that's the
gratifying.
Yes, to get those results instantaneously for your clients, to see them improve so quickly when they have lost hope and they come and they're like, oh my God, this really was the answer.
Well, we in one of our treatments rooms, it's 3 stairs down and 3 stairs up. And a lot of times people are needing help with the 3 stairs down.
Yeah, and then they're good to go on the 3 stairs.
Yeah,
that's the funny thing.
And thank God for those 3 stairs because that gives them the comparison, right? Okay.
All right.
I've had people that have come into the clinic where
even just yesterday, or not yesterday, 2 days ago when I worked on her lower back, I had to hold her hand walking.
You're talking about the PTT
that's here right now.
Yeah,
the PTT that's at our clinic.
PTT is personalized treatment and training, just for anyone who doesn't know the short form.
But she actually isn't here for a PTT. It's just personalized treatments. So it's PT because she's just coming. She's an older lady and probably roughly around her 75, 80. And she's just kind of losing like a lot of energy, doesn't have a lot of range of motion. So she just kind of wanted to come here to kind of get a refresher,
boost that vitality
get her
back
body
up.
worked on.
Well, you did 2 hours on her when we were teaching the course in Florida, and she loved it so much she flew out.
She flew out here, but no, I to cut it all short, I just was walking her into the room, walked her down the stairs, holding her hand and supporting her, and then she's like, I think I got because we're going afterwards. Afterwards, we'll usually put you on a vibration machine to get that blood circulation in there even more. And so I'm like, let's go to the vibration machine. And she's like, I'm going to walk the stairs by myself, and does it by herself. And it was really nice. So
That's
when you
awesome.
said that, it reminded me.
Yeah.
That's how fast. And guess what? That's because we gave you a new thought. What if you weren't given a new thought and you had an old thought that said you were old? Okay.
Let's get to osteoarthritis. Osteoarthritis is the most common form of arthritis, affecting millions of people worldwide. It occurs when the protective cartilage that cushions the end of your bones wears down over time. Referred to as wear and tear disease, age, sex, women are more likely to develop osteoporosis, joint injuries, genetics, repeated stress on a joint, certain metabolic diseases all play a role in the development of osteoarthritis according to the medical system. Medical treatments used for osteoarthritis include anti-inflammatories, physical therapy, cortisone injections, and joint replacement. Aftercare recommendations include losing weight, exercising, hot and cold compresses, braces, and proper footwear.
Okay, so they're absolutely right about the reasons it could happen, but that's only because you live an inflammatory lifestyle. So if you live an inflammatory lifestyle, the straw that broke the camel's back is these things that they say are the cause. If you, so you're telling me that which created the universe created a weak, dysfunctional product. I don't believe it, and you don't really believe it. So we need to just really want to take that back and take control. And this is osteoarthritis. So understand something. We already talked about it earlier about the calcium being displaced. And the calcium is actually cocooning the cartilage. It's actually getting into the cartilage, into the tissue, and it's making it seem like you have nothing when you do. You know, I can't tell you how many times people say, "Oh, that's it. Got to go to surgery for my knee. Got to go for my hip." And I go, "Well, you got nothing to lose. Why don't you just try this? I'm not going to make it any worse. If it's that bad, you got to have surgery." And you know, we bat 100%. So, you know, we can have people that want to try to prove us wrong, but the reality is that it hasn't happened for a long time. And understand something. Osteoarthritis is exactly what it is. It's where you've been pulling bone calcium out and you've been displacing it into the joint where it's not supposed to be.
Yeah.
Yeah.
And it's all because of the lifestyle, the toxic lifestyle that we're living, the acidity that we're building up in the system that's causing us to be pulling that calcium out of the bone. So the quicker we get to the perfect day, the quicker we start honoring and loving ourselves and doing the Braveheart 12 loving steps and working with some of the products that are going to actually help with your body healing this condition, you aren't going to need to rely on surgery. You're not going to have to go down that road. And then when you can get the Wolfe Non-Surgical and Wolfe Deep Tissue work done.
And understand something. We have a product called SAC Calcium, and you can be in your 80s or 90s, and you can tell me that your bones are crumbling. And if you take this product for 9 to 12 months, you'll have the bone structure of a 35-year-old. And we've proven that, not us, but the formulators have proven that thousands and thousands of times, tens of thousands of times. So the reality is that, you know, it's not hopeless. Okay? You don't even have to have hope. You just need to have faith in yourself and do the right type of energy body work and take the right energy medicine supplementation and bring up the vibration and allow the body what it was supposed to do in the first place.
Yeah. And we're going to move into rheumatoid arthritis. So you can get all of these conditions, whether it's arthritis, osteoarthritis, or rheumatoid arthritis in any joint in the body, like we mentioned.
And understand that arthritis is the beginning of the inflammation. And then as we move on here, it's just that you haven't been getting proper treatment, proper care. So it's just getting worse. It's like a pimple to a boil to a tumor. You know what? What's it going to take for you to wake up?
So rheumatoid arthritis is a chronic inflammatory disorder that can affect more than just your joints. An autoimmune disorder, rheumatoid arthritis, occurs when your immune system mistakenly attacks your own body's tissues. Doctors don't know what starts this process, although they say genetic component appears likely.
And that's not true. We already know it. It's been proven. Look up the Genome Project. Go ahead.
Yeah. It just says sex, age, weight, and environmental exposures are all said to play a role in the development of arthritis.
Why don't we just throw everything in there for good measure? Okay. All right.
And the standard approach to treating rheumatoid arthritis includes anti-inflammatory medications, corticosteroids, physical therapy, and for more severe cases, surgery. And any aftercare that they suggest is just rest, hot and cold compresses, and maintain a healthy weight to manage rheumatoid arthritis.
So the more chronic the problem becomes, the more toxic and strong the drug is, and the more invasive the therapy is going to become. So that's really, truly the bottom line. And it is an autoimmune disease, and what it happens is your body's trying to fight the inflammation off so much, okay, that it's like everything else. Did you ever go for a run and you didn't realize it, but you were coming down this big steep hill, but you kept running at the same speed? What's going to happen?
You might go tumbling.
You're going to go tumbling. And that's what happens to your immune system. It tries to pick up more speed, and it goes tumbling. And then it's called, are you ready for this? We've talked about this many times. It's called gut-brain disconnection. So now your gut doesn't talk to your brain, and your gut really looks after your immunity. It also looks after coordinating a lot of things in your body, and also your vagus nerve, which is right in the gut area, the main part, which is the belly button. It goes into lockdown, freeze, so you stay in a parasympathetic state, which is a fight, fright, flight state, which basically means that you're always on the tear, even though you're not moving. Get that tear?
So then your body's also constantly burning adrenaline and cortisol.
That's right, and you don't even know it. It's just continually dripping out now.
Yeah.
Because, that's the problem with a lot of people, and I don't want to get sidetracked, but one big traumatic moment, if they don't learn to let that go and make peace with that dramatic trauma, whether it was an accident or whether it was somebody passing, and they don't know it, but they end up reliving that on a subconscious level, then they're going to
totally
terrorize themselves, which means they're tearing themselves apart for the rest of their life.
Yeah.
Okay.
And I know, so with arthritic conditions of the hip, I know Lady Gaga specifically had problems with her hip. She's one of my favorite people. When she was doing her tour a few years ago, I got to see her first show of that tour, and then she had to cancel it pretty much right after that because she needed to get hip surgery. She was, I think, 26 or 28 at the time, really young.
So she doesn't realize it, but she already had a bowel problem and pelvic inflammation that's going to be coming for her.
Yeah, so she had, I think, just a scraping of the hip joint where they just removed probably some scar tissue and calcification, and crystallization and things like of that nature, right? So, and now it's led to, I don't know if it's led to osteoarthritis or rheumatoid, but I know that she does have arthritis of her hip now. So I would just like to put out there, anybody, if you want to share this video with Lady Gaga, I would love to help her. That would be my dream come true.
Okay, first of all, Abby, you're not going to help her. The reality is if we'll put a challenge out there to anybody who knows Lady Gaga, that if she comes to Abby, Abby's going to help Lady Gaga reverse this completely and never have this again. So whether she's dancing on stage, okay, or she's just taking a walk in the park, she's not going to have to live with the pain. And understand something, it's really important if we can get people like Lady Gaga to do something this and embrace this, so that she can be a really good representative of, yes, you can love yourself, yes, you can take your life back.
Yeah, and she's all about that now too. She's completely transformed everything. She's all about promoting love to everybody in this world. So let's show yourself more love with doing the right actions to correct what's going on in the body instead.
And getting Lady Gaga to call Abby, because that would be her dream.
Right? Let's
to
do
fix to fix her hero.
Yeah.
Right?
There we
and
go.
then who would be the hero? So we need to become each other's heroes. All right.
Lady Gaga, let me be your hero. Okay.
All right.
Next, we're going to talk about bone fractures. So bone fractures can be caused by a loss of bone density or injury. Treatments include plastic braces or casts, metal plates, screws and rods, physical therapy, and surgery. And the aftercare, again, is just physical therapy for a bone fracture.
Yeah, okay, so we're talking about bone fracture. So that that can happen anywhere in the body. So my partner and I, we were lecturing about a year ago down in Texas, and they had blocked this gate off. So we had to cut across the grass, and the grass looked like it was solid. But meanwhile, there was a hole this deep. And her foot went down and twisted, and her ankle twisted in there. And so you never really know. I mean, so here she's got osteopenia, right? And she's on a great diet and things of that nature. But now she's got the bone density of a 35-year-old. So, lots of benefits come from sometimes some tragedy, right? But when we went to the doctor, she actually had a 2.5-inch fracture long in the
tibia and fibia.
Tibia, and it was about in between 1/16 and 1/8 of an inch wide. And they said that could never fill in, that'll never heal, and if she ever hits it down, she'll just break it right off. And then on the fibula, the tibia, she had a C fracture. It looked like a C, so it started here, and then it was only being held on here, and if it could crack right through. And they said that's going to break off too. So we said, well, what's it going to, the guy goes, well, no, you got to stay. We're going to have to just strip the muscles back, strip everything back, put a plate on this side, screw it together. She'll be fine. And we said, well, how long will she be laid up for? Well, she'll be laid up for anywhere from about
5 to 7 months.
No, they said 6 to 8 months.
Oh,
6 to 8 months. So anyways, guess what? So right now she's wearing boots. We're going to go to the gala for TTAC in Anaheim to lecture, and she's walking perfectly. Okay, so now this was never going to heal. Okay, so understand something. When somebody says never to you, they're saying is, I just don't know. I just don't have all the answers.
That's as far as they can go.
That's all they know.
So when if I can't help someone, do I say, well, just go home and live with it? I don't. I go, let me try to find someone else who can help you.
Mm-hmm.
But the medical system is not allowed to refer unless it's in their own little group.
Mm-hmm.
So understand that. So never take no for an answer. And understand you can fracture anywhere. Now let me tell you another story. So there's a gentleman he's an older gentleman, and he fractured his leg, his fibula. And guess what? So anyways, this has been going on for a long time. And so the daughter says, okay, so it's been like almost 8 months, Dad. So she goes to get the x-ray. It's completely fixed, but he can't walk on it for the pain. And she said, it's completely healed, Dad. And guess what? That next moment, he was out of pain. So I was just like, wow.
The mind is so powerful.
Do you want proof on that one?
Wow.
Okay. And guess what he was doing? He was dragging his leg. So he was dragging his leg for months. So he continued to drag his leg.
So
and
subconsciously, it was like pretending it was still injured.
No, as long as he's dragged his leg, his brain said that you're in pain.
It's still wrong.
And he went, oh.
So he was babying it, and through babying it for so long, it just like stuck with him subconsciously that it was in that state all the time.
Yeah, so I just want you to understand where the mind goes.
The body follows.
All right.
Okay. So next we have, and of course, the bone density loss with bone fractures can be fixed with the SAC calcium.
Yes, it can. And also stop terrorizing yourself on an emotional level.
Yeah.
And then stop bringing inflammatory foods.
Yeah. And the hips hold a lot of fear. So that's something to really think about too.
Yeah.
If you are going through any hip conditions, or you get a lot of pain in your hips or anything, maybe look at what you're fearful in your life. Next up, we have hip replacements. So a hip replacement is a surgical procedure in which the hip joint is replaced by a prosthetic implant, that is a hip prosthesis. Hip replacement surgery can be performed as a total replacement or a half replacement. Some complications that can occur with a hip replacement are infection, dislocation, limb length inequality, fracture, loosening, metal toxicity, metal sensitivity, nerve palsy, and chronic pain. The cause for a hip replacement, or the need for one, would be to relieve severe pain caused by osteoarthritis. People who need hip replacement surgeries.
But that's not true. You don't have to.
Yeah.
Okay, let's go a little slower here.
Sure.
Okay. Go ahead.
Oh, okay. People who need hip replacement surgeries usually have problems walking, climbing stairs, and getting in and out of chairs.
Yeah, but that's scar tissue and calcification, and that's what's locking them up.
Yeah.
So they can't.
Yeah, exactly.
So that's not true.
No.
Keep going.
And then the treatment is, of course, a surgery. Pain and anti-inflammatory medications are used as treatment and aftercare for this condition.
And just remember that surgery, they're going in to cut out the scar tissue, but the surgery causes more adhesions in the first place.
Mm-hmm.
And go ahead.
Yeah, even with that, I wonder if they're even going to get the scar tissue.
Yeah, are they going to?
Yeah.
You know?
Yeah.
They might be, because they're going in, they're replacing the joint, and it's really important to understand that they're using very toxic materials when they're doing implants. They're lots of the times, depending on who you're getting it from,
Well,
I guess, but it can be titanium.
Yeah, but
there were like,
but it doesn't even matter if it's not toxic.
Yeah.
Did you ever have a sliver?
Totally.
Yeah, something
Yeah.
foreign
It
in your
festers
body
up.
is
It's
irritating.
a foreign object. So you know what? They're going to keep telling us that this is non-toxic, this is non-toxic, right? It's the same thing with, okay, now we're going to poo-poo on cigarettes, okay, because now all the tobacco farmers want to start growing hemp. So, but what they did was they said, we just need to go to vaping, and that's even more toxic than the cigarettes. So there's always going to be a shell game, and you're always going to get screwed. So that's the bottom line right there. And understand something too. I'm not putting down surgery. I'm not putting down even these things. What about somebody who gets in a car accident?
Yeah.
Right? What if it's totally damaged?
Totally.
Shattered.
So you know
like
what?
They need
You
that.
know, that's called 911
One
emergency.
That's
And
when it should be utilized.
And that's a life-saving thing. And then if that person was taught how to counteract the infection, the inflammation, and the pain they're going to get from having that foreign object, that would improve their life. Because I'd like to walk my little child with my child. So understand, we're not poo-pooing on that, but I am poo-pooing on 99% of all these surgeries don't have to be done. Okay, but they will have to be done as long as you believe they need to be done. Okay.
Let
Definitely.
yourself become more aware. Start the
Yeah.
perfect day. Look at the 12 loving steps,
Yeah.
and this won't have to get there. You won't have to have surgery.
And why don't you give your family a real gift and get one of our master trainers to come to your home and do a personal treatment and training and train the whole family.
Yeah.
You know, we've trained children up as young as 6 years old a long time ago. Remember, he was 6.
7, but yeah, same thing.
6,
It's the
7,
same thing.
Yeah.
6 or 7. It was a while, you know.
Yeah.
But then we just did a boy that was 14 and one that was
14 and 15.
15 with his family. The whole
Yeah.
family did it together.
And when you're young, you absorb things so easily that it's the best age to learn it, because you're just going from your heart. You're going with your intuition.
Yeah.
So you pick it up so easily, and you're just coming from a place of love all the time. So taking this and learning this from a young age is one of the most amazing things that you can do for your family.
And understand this. Go on our website and take a look at what naturopaths say. Go take a look at what nurses say. Go see what chiropractors say. Go see what the professionals say about our course. So that's the bottom line. Okay? Are we family? Are we one? Let's find out.
Yeah.
Okay?
And if any of these conditions resonated with you to do with the hip, or if you were like, hey, that's me. Or
I have a hip problem.
You see those dominoes effect. You see that domino effect falling for you, then definitely check out our hip condition treatment video. We're going to be doing that for you, talking about exactly what we do for pre-care, during the treatment, and post-care, and what you can do when you go home. And the next series we're going to be doing is on knee conditions. So definitely check that out, because
You may not know this, but 70% of the population has knee problems. And you may not know this either, but 1 out of every 4 children have knee problems. Do you know why? Well, we'll tell you.
And for the next series, we are going to be talking about knee conditions. And you are not going to want to miss this one, because guess what?
Because the majority of the population has knee problems. 70% of the population has knee problems. 1 out of every 4 children has a knee problem. And we're going to tell you why. And guess what? Nobody has to have this. Thanks for joining us. We'll see you in the next show.
See you there.
Welcome back, everyone, to the International Training Institute of Health Bodywork Masterclass. And what we're going to do right now is we're going to show you how we work with the hip and how you can prevent having hip replacement, how you can prevent having arthritis, how you can prevent having sciatica pain, how you can prevent going from a cane to a walker to a wheelchair or an electric scooter. Okay, and I'll tell you something. Once this hip goes, okay, and you can't get around and you can't look after yourself, that's not a good situation. And we promise you that even if you have a cane or you have a walker or even have your wheelchair, as long as you haven't been in that wheelchair for years, you're coming out of that wheelchair, because we're going to change the whole way of thinking when it comes to dealing with the human body, and especially working with the hip. Everybody, when they look at the hip, they go, we don't know what to do with it. Well, that's because they're not looking in the right place. It's all about in the joint. It's all about scar tissue. It's all about crystallization. And it's all about calcification. And it's all about this joint, okay, getting like beef jerky and rubbing on it. And it's rubbing against itself like sandpaper. And guess what? And even if they tell you that your hip is bone on bone, don't believe it until you come to see us. Because I'm going to tell you something right now. We have a money-back guarantee that we're going to work on your hip, and we're going to show you that the body heals itself when you bring in the right foundational tools, nutrition, and detoxification, and the right body work, which is Wolfe Deep Tissue. And we're going to turn around that issue, and we have a money-back guarantee. But we're going to tell you how we do that hip work, and then you decide for yourself.
Mm-hmm. And speaking of hip replacements, we've had a lot of people recently coming to us canceling.
That we're going to have hip replacements, and we haven't had anybody go for hip replacements or knee replacements or have spinal surgery or going for frozen shoulder or carpal tunnel syndrome in the last, what? How long have you been with us?
Almost 7 years.
Has anybody went to surgery yet?
No.
Okay, so either she's a liar, liar, pants on fire, or we might have something you need to look at. And I know that even though you've never heard about this before, or it sounds quite unusual, and if it was so good, why wouldn't anybody have it? Well, I just told you that if you can get here, or you want us to come to you for a personal treatment and training, you want to come and get certified, or you've got a clinic that you want certified, or you want to just come and get the treatments, we're going to give you that guarantee that we stand behind what I just said. Okay?
And that's the thing too. We've had a lot of people come to us who've actually already had hip replacements as well. And all they ever say is, I wish I would have known about you before I would have had this done, because it's just completely taken their health down. There's now a foreign object in their hip, and their body is constantly trying to attack that foreign object, and it's just causing more and more problems. Eventually, most people end up needing a double hip replacement because that's just the way it goes. And then it leads to knee replacements. And all of this can all be prevented. None of this needs to happen. All we have to really go to is the root and get rid of the crystallization.
Go to the cause
Yeah.
and understand something. Have you ever had a sliver in your foot? One little sliver. And what did it do? It caused infection. And that sliver could have been wood, all natural wood from just a stick. But now we're talking about putting metal or plastics, okay, into your body. And guess what? It's a foreign object, and there's no way in the world. And guess what? You think that you get a hip replacement and you're just going to have pain here? No. You may not have any pain here from all the scar tissue that's growing, and you can't feel it anymore. But you know what? This here could cause you to have an inflamed heart. It could have you to have breathing problems. It could help you even advance your Alzheimer's. So guess what? It's going to go anywhere. Are you trying to tell me that the same blood that flows here doesn't flow all around the body, and it does it many times during the day? Absolutely. So let's just understand something. You know what? Thank God that they have surgeries like this for people who really need them. But 99% of all surgeries do not have to be done because it is chronic problems, because you've never known that you should be doing self-care, not health-care, that you should be doing self-love and taking personal action and learning, and that's what we do. I've spent 40 years putting this together, all right? And I want you to come and challenge us on our guarantees. Let's go through it.
All right, so I'm first going to just touch on some emotional attachments that can be tied to the hip. So these include fear, anxiety, sadness, and sexual trauma. Sexual trauma's origin is in the mind, but it wraps itself around the reproductive organs and is spilling over from the pelvis. So with everything to do with the hips, it has to do with the pelvis, because it's obviously in the same area. It's right there.
Hey, it's in the neighborhood.
Yeah.
You know what? The way that you act, you're going to tell me it doesn't affect your wife or your husband or your children?
Yeah, exactly. And we see women with hip problems a lot of the times really struggling with that. And a lot of the times when you get in there, they do feel like their family is coming out through through the therapy, because they've just put themselves second for so long, and they just finally are taking care of themselves. And it's really amazing to see the transformation that even just a hip treatment can give on somebody's psychological health. So
that's right. You've got junk in your trunk.
Yeah. All right. So we're going to start and talk about the treatment that we do for the hip. So we always start at the top of the hip bone, or the iliac crest, and we're always bringing it down into the origin, which is the head of the femur, or the greater trochanter.
Yeah.
So I'll let Sage take her away.
So we start, as Abby was saying, top of the iliac crest, where we almost finished with the lower back, where we couldn't get to that side because that would be too awkward for us. So we're working along the side of the iliac crest from the top, working down towards the greater trochanter, so like pretty much where this ball is. So where that ball is, and then you have your gluteal process and a bunch of other stuff in there that doesn't even matter, because what's the problem? It's the scar tissue crystallization, inflammation, and calcification. So that's what we got to go in and kind of work on. You can have a different bone completely, but it's not the problem. So
It doesn't matter
it
where
doesn't
you go
matter.
in the
Like,
body.
It's all the same. In all honesty, it's scar tissue crystallization and calcification. And you're going to hear it through this whole season. And so we're working down towards the greater trochanter. We're really isolating this joint, though, because it's like a ball, like I said. And then calcification is going to like overlap on top. Why do some people have such large hips? Because their body's been so inflamed from their large intestine, seeping waste into their blood, letting that toxicity level raise, having that inflammation. And then all of a sudden, calcium starts leaking from your bones to kind of buffer down the acidity. And then you see women on the street, men on the street with hips.
And also it's scar tissue, and also it's also fat.
Yeah.
Because your hips are going to make fat. There's so much toxins.
To
and
store the toxins.
They've got to store it because you need to have that fat. If you didn't have the fat, you'd be losing so much calcium that your leg would fall off.
And that's why you see people with such big hips, is because the large intestine is right next door. So it just needs something to store all of that waste.
Yeah, that's,
Exactly.
you know what? This is just an extra luggage rack until you learn how to take your health back.
Exactly.
Okay.
And so
Alright.
you're going to isolate this area. So we want to come at least 2 to 3 inches into that iliotibial band to loosen that up as well and bring more blood flow, circulation, and temperature into that area.
And sometimes this is going to be like a 2x4.
Yeah.
It's
Seriously,
so
it's like
hard
cements.
because there's been so much inflammation, and it's created so much fibrous scar tissue to try to protect itself. Grandpa, why are you walking as stiff as a board? Are you in pain? Don't feel a thing, honey.
Yeah.
'Kay.
That's like when you work on a bodybuilder and you work on their IT band, it's literally a rock because they're doing such contractual workouts and not doing it the right way.
Microtearing.
And
Yeah.
not following the perfect day diet.
But
probably
working on them is super easy because they're sensitive little babies, because they're carb junkies, so their body's constantly firing off. They can't
Now
handle
be nice,
much.
but be nice.
It's true. I go to the gym every day. I'm the exact same thing. But I try to put in the perfect day diet and the 12 loving Braveheart steps because I love myself.
Good. All right. So where are we going now?
All right. So we would do this from both sides,
Both
of
sides,
course.
yeah.
We always do that. And then
And you're doing it from both sides, both directions.
All angles.
Yeah, it's okay. We have about 12 different steps that go
Yeah.
on here.
if you
Okay.
think of like this is like almost a clock, you're going to go from 12 all the way around.
Exactly.
And you're going to finish it, right? You want to go circle it. You're pulling everything in and you're pulling everything away. That's why we do it from both
We're
sides.
strategic,
Yes.
and we're not leaving until we take back the land.
Exactly.
And then after that, this is amazing for sciatica. So when they're in this position, you can really come through the side of the glute down to the ischial tuberosity and really clean that sheath.
Exactly.
Yeah.
You can reach over, come into this area on the backside near her bum cheek.
From
and we're
over
coming
there,
in.
you reach over.
We reach over, we work into here, and that's right where the ischial tuberosity is. And we just clean that out.
Yeah, and then after that, we come and we work on the hip flexor because we want to come full circle and do the entire
So
hip joint.
we'd have her flip onto her stomach. We'd work down the hip
her back.
flexor. Or, flip onto her back. And then we'd work down her hip flexor in like this with her legs open, in half butterfly pose, and in full butterfly pose.
Yeah, so we show that in more detail in the pelvic clearance treatment. So definitely go check that out if you're interested in what we do for the hip flexor. Honestly, one of the most amazing treatments for the hips. Most people's
if
hip
you have
flexors
any
are like,
sort of hip problem.
yeah, their hip flexors, they like adhere to all the bones and everything in the area. So you can get a major pull inwards, and that's why people get a lot of pelvic tilts and different things as well, is because it's just so contracted in the pelvis. So once we can get in there and pull the scar tissue up open so that the blood flow, lymph flow, and circulation comes through, and it's just healthy tissue again. The crystallization has
It's
been
automatic.
melted.
It's
And
automatic.
Honestly,
As soon as you get the blood back in, it brings in the energy.
Yeah.
It brings in the oxygen. The scar tissue turns into beautiful connective tissue. It's not like the scar tissue went anywhere. It's just that we brought it back to life.
Yeah.
But you
Right.
honestly, like after the treatment, when you stand up, you feel like you're a teenager again. Like
Yeah.
the flow coming through your hips is incredible, and you've like didn't realize you lost that mobility or that flexibility until you get it back.
So we'll have people coming in dragging their leg or limping, and we'll let you finish the rest of the story.
Yeah.
Okay?
So that covers our hip treatment. And then, of course, check out our pre and post care video for what we do prior to and after the treatment and what we suggest to bring home.
Definitely, we'll be doing the pelvic expansion.
Oh, yes.
Oh, yeah.
Then we'll do the Avicen. We'll do the Bioptron. And then we'll send them home with
Yeah. The DMSO, essential oils, the perfect day, the
Proper
Braveheart 12
exercises.
self-loving steps,
Yep.
proper stretches, and of course we would love if everybody brings home all of the energy medicine healing, because that's the future. That's what's going to keep you healthy and your family healthy.
shortcut.
Yeah, exactly.
So thanks everybody for tuning in today, and we'll see you on the next episode.
Have the best day of your life.
Until tomorrow.
Bye for now.